Hi everyone, I'm currently coming up to the end of my Invisalign treatment. I started in January and I finished in about a week, so I thought it was about time to make a video for you all. I want this to be a really informative, detailed video. Hopefully it's going to help you out with any questions you have about the process and leave you feeling really well prepared. So without further ado, let's get on with the video. So first of all, what is Invisalign? I'm sure you know, but I'm going to go over it anyway. Invisalign is a way of moving your teeth, and it uses a series of trays which you change every 2 weeks. Now the aligners or trays look like this. As you can see, they are clear plastic, very thin. They're a little bit flexible, but not very, so be careful with them because they can snap. And how they make these is they either do a scan or take impressions of your teeth. These are then sent to the Invisalign lab, who will then send back a ClinCheck. What a ClinCheck is it is a 3D model of your teeth. And you can watch this 3D model change every 2 weeks with the different trays, so you have a total look of your treatment all the way through the process. Now, there are a few different features of the Invisalign trays that I want to tell you about. One of those is attachments. Now, if you can see, there are some little bubbles on these trays. You see them along here? Now, what your dentist will do is attach little bits of cement to certain teeth, and then these attachment bubbles will fit over those. That just gives certain teeth a little bit more force if they need it. Now, what you can also have on your trays is something called power ridges. Can you see those two horizontal lines on the top of the front teeth? These are used when you might have teeth that are quite inclined, quite slanted, and they will just give those a little bit extra force. What you can also have is elastic bands, like on traditional braces, and something else I want to mention is that with Invisalign they don't remove teeth, you have filing between your teeth. This is called IPR. It's only a few millimeters, you might have it a few times during treatment, and this just makes space for teeth to move into. Does Invisalign hurt? Yes, I would be lying if I said it didn't. It can hurt a lot at some points, but it's never anything that you can't deal with a painkiller and some icy water, and it is something that gets better along the process. You can have Invisalign at any age, whether you're 18 or 80, but I would have some reservations about recommending them for young teens, and that's only because you do need to wear Invisalign for a lot of the time. It needs to be about 22 hours a day. So if you think that your young teen wouldn't wear them that long, they might forget to put them in, they might not want to take them in and out at parties or school, then I'd reconsider Invisalign, because if you don't wear them for the full amount of time, they're not going to work. There are a few different Invisalign plans. I had Invisalign Lite, but there's also Full, Express, Teen, and I think there are a few others. It's all the same product, it's just a different package. So I can't tell you about all the individual ones, but rest assured that it's all the same product, just in a different way of doing things. How much does it cost? I'm afraid I can't tell you. That's something that is very specific and personalised to every person, and it's something that you're going to have to ask your dentist about. No one on the internet can tell you how much it can cost, but I can tell you that it's going to range from about £1,500 to £5,000 plus. It's going to depend on the severity of your crookedness or crowdedness. It's going to depend on the treatment time. It's going to depend on the experience of your dentist. So I'm afraid that is something that you're going to have a consultation about to find out. So now we've got those basics out of the way, we're going to talk about how to pick a dentist. If your regular dentist doesn't do Invisalign, ask them. They might know someone who's been recommended to them, someone they used to work with, something like that. So ask them for a recommendation, because they're going to know what they're doing. If not, if they don't know anyone, you can Google. Either Google for people in your area or check braces or Invisalign forums. Check plastic surgery websites, because they often have a little Invisalign category for you to look through. And also, you can just kind of ask around on Facebook. If you know anyone who's had it, you can ask on the Invisalign page, in a Facebook group that I'll link below. So just kind of browse the internet for people in your area, and then when you've picked a few, have as many consultations as you possibly can. The consultations are often free, so make the most of them. And I tell you to have as many as you can, because the price really, really varies. I've had 2 quotes when I was getting Invisalign that were £2,000 apart. So it is worth having as many consultations as you possibly can. Now I just want to give you a tiny warning about certain voucher sites and certain special offers that make you save a lot of money on Invisalign. The reason I want to warn you is because Invisalign certificates are done by quantity of patients treated rather than the quality. So an inexperienced dentist can easily up their number of patients by offering very cheap deals. Now, if you're going to take one of these deals, you need to be very careful. You need to check out the dentist properly, make sure they're experienced, ask for before and after photos of work that they've done, because if not, you might end up in a position where you're going to end up spending more money on fixing your teeth because you tried to save money and picked an inexperienced dentist. Something else you need to be careful of is people who will sell different brands of clear braces as Invisalign. Those braces might work great, they might be just as good, I don't know. But the thing is, they're lying to you by selling them as something that they're not. But luckily, it's kind of easy to work out whether they're lying or not, because in my dentist office at least, there is Invisalign branding everywhere. They have a big Invisalign poster, they have Invisalign leaflets, so look out for that stuff and you should be able to check out if they're genuine or not. Luckily for us, it's very easy to tell whether your trays are genuine or not. They have Invisalign printed on them, and they will also come in lovely little bags. So if that's all true, you've got genuine Invisalign and you don't need to worry. Your consultation is important because it's the time you're going to get to ask all the questions before you put your money down, so make sure you make the most of the consultation. Talk about specific areas that you're not happy with and find out if they can be fixed. Also, something that you need to ask about is attachments. You see those little bubbles I told you about? Now on mine, they're just around here. So that's okay, they're not visible. But some people don't ask about attachments, and then when they get their trays, they find out that they're on the front. Now that really ruins the visibility, so it's something that you need to ask about. So make sure you find out how many attachments am I going to have and where will they be. Another thing you need to find out about is what the cost you're quoted actually includes. Is it going to include whitening? Is it going to include your retainer after treatment? Is it going to include refinements, which are extra trays at the end of treatment if things aren't quite right? You need to ask what's going to happen if it doesn't turn out how I want it. Are you going to fix it or will I have to pay more? You also need to find out how you're going to pay. Is it going to be in instalments, monthly, weekly, when you pick up your trays, etc. I'm going to make a list of these questions down below in the description box. I really advise that you take a list of questions with you, take a pen and paper with you, and get all the information you can out of that consultation. So your first appointment when you've picked a dentist is going to be very simple and quick. All you're going to have done is have either a scan or impressions taken, which is where they fill little trays with putty and do upper and lower. And then they're going to send those scans or impressions off to Invisalign in America, and they are going to make a 3D model of your teeth. And they're going to make a treatment plan for you. They're going to send an electronic copy of that back to your dentist, who's hopefully going to let you look at it. And then you are going to say whether you're happy with it or not. If you're not happy, they can send it back and tweak it, so don't feel pressured into accepting it. But when you are happy with it, you will accept it, and then within a few weeks you're going to have your trays. So now it's time to collect your trays, and I remember this day very well. I was so excited, and I'm sure you will be as well. It's a very exciting day. You get this box, and this includes a care leaflet, just telling you about Invisalign, how to look after them. And it also includes 2 retainer cases to keep your trays in. And I'm afraid to tell you that the cat stickers don't come with them, unfortunately, but you can obviously decorate them as you wish. If you're going to have attachments, this is usually when they put them on, but sometimes they do it later in the treatment. How they do it is they'll fill these little bubbles with the cement, and then they put them on. And then they use a special light to kind of fix that to your teeth to bond it on, and then you're done. The attachment material will be tooth coloured, so don't worry, it blends in as well as it can. Another thing you might have is IPR. Described that briefly at the start of the video. Now, I had this done midway in treatment, but you might have to have it done at the start. It isn't the most comfortable treatment, but it doesn't hurt. They kind of just drill in between your teeth with a very tiny file, and it feels extremely cold, but it's not painful. Now your first tray isn't going to feel that painful at first, it's just going to feel tight. When it starts to feel painful is when you take the tray out. That's because when you put the tray in, you're forcing your teeth into a new position, and every time you take it out, your teeth are going to shift back. Teeth move very quickly. So what you want to do to reduce the pain of the first tray, and any tray really, is put it in after you've eaten and leave it in all night and for as long as possible the next morning. Right, your first tray is going to hurt a lot. I'm not going to lie to you, it's going to be extremely, extremely painful. There were moments in the first tray where I thought, why am I doing this to myself? This is horrific. Only thing I can compare it to is being punched repeatedly in the mouth all the way around. Your teeth are going to feel loose and wobbly and sore. Your gums are going to hurt. You might have little cuts around your mouth from the trays. And, it's just not very nice. But one thing I can tell you is it's only the first tray. After that, your mouth toughens up and gets used to it. It's not going to hurt as much, and the pain is never going to be as bad as that. So just hold on. Try to work through the pain, take some painkillers if you need to, and don't let it discourage you. Because of how painful the first tray is, I would recommend scheduling that first appointment away from any important events. Don't put it in 2 days before Christmas or before your birthday or before you have an interview or something like that. Make sure you can have your first tray in a period of time where nothing important is happening. Another reason for that is that you will probably get a list with your first tray. I still have a little bit of one, but it will mostly go after your first tray, but during that it's going to be horrific, so don't have something important around your first tray. The first time you take your tray out, it's going to be hard. It's something you've never done before. Everything's going to feel very tight and painful and you're not sure how much pressure you can put on them. Don't worry, relax, don't stress. Sit down and have a break and come back to it. Don't worry about being trapped in plastic forever. You will get them off, it's just going to take some patience. But by the end of your treatment, or a few weeks in anyway, you're going to be able to pop them out really quickly. In and out, just instantly. You're going to learn the knack to your trays. Everyone's different. For me, it's hook up here, pull down here. But some people do it differently, other people use tools. I'm going to show you how I do mine. So for me, I hook up here, and then I have to use 2 for that top one. Like I said, everyone's different. And then to put them back in, it's very simple, they just pop in. Perfect. How strict do you have to be with wear time? The answer is very strict. Now, as I described a little bit before, every time you put your trays in, they're being forced into a new position. And every time you take them out, your teeth are working back to their original position. So it's kind of like your teeth are fighting against the Invisalign. If you're going to be someone who wants to take your Invisalign out for long periods of time, your teeth are going to be moving back. It's not only going to hurt more, but you're going to jeopardize your progress, because if your teeth don't move totally into the new tray, and then you put the new tray on, the next tray, it might not even fit. So you're going to be paying all of this money for Invisalign, but if you're not wearing it enough, it's not going to work. So you're looking to aim for 22 hours or at least 20 hours a day of wearing Invisalign. Occasionally during your treatment, an important event might come up and it might be extremely inconvenient for you to switch to a new tray just before that event. On these occasions, it is okay to tweak your plan a tiny bit, but hear me here, make this rare, okay? Don't make this a constant thing. Say if you usually change your trays on a Wednesday night, but your best friend's birthday is on the Thursday, either leave your tray in and change it on the Thursday or Friday night, or change one day earlier. But don't do that often. That's okay to do if you have something important, but don't do it often. It's a little bit of leeway for important events, but as I said, don't do it often. You may or may not know, but with Invisalign, every time you eat, you need to brush your teeth. Every single time you have breakfast, lunch, a snack, dinner, anything, you need to brush your teeth. The reason for this is because a normal person without Invisalign, when they eat, all of their saliva can get over all of their teeth and cleanse them. When you have Invisalign, you are putting your trays on and you are trapping everything there. There's no saliva flow. So any food particles on your teeth are going to be stuck there. They're going to rot, they're going to cause decay, you might get cavities. So brushing your teeth is extremely important. Because of this, whenever you go out when you're going to eat or drink outside, you're going to want to take a little Invisalign bag with you. Mine's just a little makeup bag. I'm going to show you what I have in it. So I've got my retainer case. Now you always need to keep one of these with you, and the reason for this is when you're eating, if you put your trays in here, people are going to look at it and think, oh, that belongs to that person. I won't touch that. If you wrap your trays in a bit of tissue, you're going to put that on the side of the table Someone's going to walk past, think it's rubbish, they're going to pick it up, put it in the bin, and there your trays are gone. So always, 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 please always put them in this, every time. Never be lazy, always put them somewhere safe so they're not going to get thrown away and you're not going to lose them. Other things, toothbrush, of course. I love these little foldable ones because they're less messy. This was from Boots. Toothpaste. And also, you should always keep some tissues, because if you're brushing your teeth in a public bathroom, there might not be anything to wipe your mouth with, because it's going to get wet, there might be toothpaste, so always keep some tissues in there as well. Also remember to quickly give your trays a little bit of a brush while you're brushing your teeth, because although there shouldn't be anything in there, should there be any food particles in there somehow, it's good to just keep on top of that. Remember to never ever brush your trays with hot water, because they are plastic and they will melt. Now I know it's not always convenient to brush your teeth in public. For starters, there might not even be anywhere to do it. So if that is the case, you can cheat, but this has to be a very rare thing. Again, all of these little exceptions to the Invisalign rules have to be exceptions. If you can't brush your teeth, you can use chewing gum. You know those whitening chewing gums with the particles in? They'll do. You can chew on one of those for like 5 or 10 minutes and put your trays back in, and that's alright. It'll do the job, kinda, but as soon as you're in a place where you can brush your teeth, do it, because like I said, there's a cavity risk there and you don't want to be messing up your beautiful new straight teeth with loads of cavities because you didn't brush them. Regarding eating and drinking again, you can drink water with your trays in. You cannot drink any hot liquids, no hot liquids, because the hot liquid will melt your trays. You can't eat with them in. I mean, you probably could if you wanted to, but it might be kind of gross and weird feeling. Don't do that. You can drink some liquids through a straw, but only if you know that you can brush your teeth very soon. So for example, if I'm on the way somewhere and I know I can brush my teeth when I get there, I might drink Coke through a straw. Just make sure that you don't drink anything that can stain the trays, and make sure that you're going to brush your teeth and the trays thoroughly as soon as you can to keep that cavity risk low. At some point in the day, you're going to want to give your trays a deep clean. This can either be daily or every 2 days. Now you can do this by using Retainer Bright, or you can use washing up liquid. I use a mix of both, not together, just at different times. You just want to do this just to kind of make sure your trays are super clean and keep them fresh, because if you do not clean your trays, if you keep putting them back in on teeth you haven't cleaned, your trays are going to start smelling. Not nice, but you can avoid it entirely by keeping them clean and doing an occasional deep clean. So we've basically covered the entire process. All that's left is what happens at the end. So when you finish Invisalign, you will need to wear your trays full time for a while. This is just to set your teeth and make sure they're not going to shift back. After that, you're going to switch to a retainer that you wear at night. Or you might have a bonded retainer. This is something you need to discuss with your dentist throughout the process and at the consultation. You are going to have to wear your retainer for the rest of your life at night, but good thing with Invisalign is, because you've been wearing your trays almost 24/7 anyway, it's not going to feel like much of a hassle to wear a retainer at night. Hopefully, so far you've heard all you wanted to know about consultations, your first appointment, your first tray, pain, cleaning, maintenance. Hopefully I've covered it all. If not, leave me a question below and I will be happy to answer it for you. Now I'm going to move on to some of my personal experiences with Invisalign, my personal list of pros and cons, and my overall thoughts about the treatment. So there are some negatives to Invisalign. One of the big ones for me was what we call the Invisalign diet. Because your first tray is very painful, and because you don't want to take it out because it hurts a lot to take it out, you probably won't eat very much in that first week or so. If you wanted to lose weight anyway, that's great, but if you're already slim and you don't really want to lose weight, then it might be a little bit of a shock. You might lose a few pounds, you might not be happy with it. Another thing to do with food is you do have to adapt your eating habits. Before Invisalign, I was a grazer. I would just eat little and often all day, but because you need to brush your teeth every single time, that's extremely inconvenient. So if you're like me and you're a grazer, you're going to want to adapt to eating bigger meals less often, really substantial meals that are going to keep you going so you don't have to brush your teeth as often. Sometimes, but not all the time, Invisalign's going to restrict what you can eat. For example, if you just changed your tray 2 days ago, you're not going to be able to bite into corn on the cob, stuff like that. But in the second week of every tray, you can eat whatever you want, so there aren't really any restrictions with food. A problem that I've had with Invisalign is I have this very irritating little rash. I've had it since I started, and I think it's just from the irritation of me kind of going in and out of my mouth and rubbing my skin with my thumb. I can't seem to shift it, so I'm looking forward to when I have my overnight retainer and I don't have to deal with that annoying rash. Usually I conceal it, but I left it just to see if you could possibly see it. It's not a huge deal, it's just minorly irritating. Another annoying thing about Invisalign is that it makes your mouth extremely dry. You're going to want to take a bottle of water with you everywhere. If you have a Costco membership, now is the time to stock up on bottled water. You may have noticed my voice has gone a little bit through this video because I've just been talking so much, and because Invisalign makes your mouth so dry, it does kind of mess with your voice a little bit. But just make sure you can always have a drink. Make sure, especially on warm days, you can always have a drink, because if you don't, you're going to be extremely uncomfortable and you're going to be more aware of the trays the drier your mouth is. Another downside of Invisalign is that brushing your teeth can be very awkward sometimes. If you have a circle of friends that know, then they're not going to care, if you go to the bathroom obsessively to brush your teeth. But if you're around new people, it can be a little bit awkward having to go and brush your teeth all the time. But it's a minor thing and you do get over it. One thing that I have noticed about Invisalign that is a problem is that if you get a cold or an infection, it seems to make it linger a lot longer. Now, I'm not, a doctor or a scientist or anything like that, but I think what happens is your trays kind of act as like a breeding ground for bacteria or something, so every time you're putting them back in, you're kind of reinfecting yourself. I've heard this from a lot of people who use Invisalign, and I think that it does prolong illnesses in general. So if you are having a cold or an infection, every time you take your Invisalign out, you want to sterilise them. You can do this in like mouthwash, or you can use like Dettol or any kind of antibacterial spray. Just make sure that you clean them very thoroughly before you put them back in your mouth. That way you're going to deal with your infection or cold like a normal person, instead of a person who has plastic in their mouth all the time. Another downside is that if you wear lipstick, it gets all over your trays. You can kind of get around this by blotting your lipstick very well, but still it usually ends up all over your trays and you end up with a weird pink or red mouth. There are some lipsticks that are better for Invisalign than others. If you'd like me to make a video on recommendations for that, let me know in the comments section and I will. But that's kind of, it's not a huge issue, it's just if you're used to wearing lipstick all the time, suddenly you can't. Final downside of Invisalign is just the basic fact that they can be lost. As long as you keep them in your retainer case at all times, shouldn't be a problem, but still it's a risk that metal braces don't have. So on to what I love about Invisalign. One of the biggest things for me is the confidence I have now. If you're unhappy with your teeth, you'll probably know what I mean when I talk about hiding your teeth, not smiling as much as you'd like to because you don't like your teeth. Well, about halfway through my Invisalign treatment, I started to really change in that aspect. I started to really feel much more comfortable with my teeth. I used to smile a lot more. I smile way more now. And that it just makes you so much happier, more confident. It makes it easier to meet and talk to new people, makes it easier to socialise, makes it easier to laugh because you're not thinking about hiding your teeth, you're just relaxing. So that is one of the biggest reasons that I love Invisalign. Another thing I really like about Invisalign is the clean check, because with that you can see your teeth along every step of the way. You know exactly how they're going to turn out. There's always something to look forward to. And even if you feel like there's not much movement in the tray you're wearing right now, then you know that within a few they're going to look totally different. So there's always something to look forward to. You never feel stuck. You always feel like progress is happening. Another thing along that line is that progress is so quick with Invisalign. My treatment was 28 weeks, and you've seen the before and after, and that's just amazing for such a short space of time. I mean, I'm finishing in a week, and it feels like I only just started. Another thing I really like about Invisalign is that they do live up to the name. They are not obvious. I've been wearing these for the whole video. I don't know if you've noticed them or not, but they're definitely not eye-catching, are they? They are very discreet, and that's really important because if you are extremely insecure about your teeth, the last thing you want to do is draw more attention to them with traditional braces. So for me, Invisalign was great because it was just a very discreet way to slowly change my teeth. Nobody was going to point them out to me or ask about them. In fact, nobody has. So they are quite discreet. They do live up to the name, and I think that's really important and a really good point of Invisalign. And again, I mentioned this earlier, but because you get used to wearing a retainer all the time, instead of having metal braces all the time and suddenly having to wear a retainer, you kind of get used to it, so it's not really a big deal. Learning that you're going to have to wear a retainer full time and then at night for the rest of your life is not a stress because you already do it. So in that sense, it makes the transition from treatment stage to the after process very, very easy. It's really no different, and it's something that you're already used to. So that's about it. Hopefully I've covered everything you wanted to know. I tried my best to be extremely thorough with this video because I think that you need to be very well informed about things like this. But if I haven't been as thorough as I thought, and there are things I've missed or any questions you have, no matter how big or small, please feel free to ask me in the comments below and I will be more than happy to help you out. I love Invisalign, I'm very happy with it, and I would definitely recommend this treatment. It really is probably the best decision I've ever made. It's made me a lot happier, a lot more confident, and it's amazing really. It has so many benefits over traditional braces. It's convenient, it's discreet, it's fast, you can always track your progress, and really apart from those very, very minor negative points, there's nothing I'd say that should stop you from getting Invisalign. The only thing I'd reinforce is that if you're not going to wear them for the right amount of time, they might not work. But as long as you can do that, as long as you can be a compliant patient and wear them properly, there's no reason you shouldn't get them, and I would look forward to hearing about whether you do go forward with them and how you find them. So thanks for watching my video. I really do hope you found it useful. I know when I was thinking of getting Invisalign, I spent so much time reading blog posts, watching videos, trying to find out more. Hopefully I've made that step of the process a little bit easier for you. So thanks for watching again. Hope you enjoyed it, and I will see you again soon.